Good morning, everybody. We have a beautiful atmospheric Boston morning. I would like to introduce myself first. I'm Karen Bressler. I'm the board chair of Community Servings. In 2001, when Community Servings was in Roxbury on Magazine Street, I went in for a sales call. I was the CEO of Agar Food Distribution, and I looked around and I saw that they were all about delicious food, helping people, specifically at that time helping people who were dying of AIDS. And they were in Roxbury, where our business was in the Meat District, as well as my home was in the South End. So I came in 2001, and I'm still here today. I've never left. I'm on my third term as board chair. But I feel like I've been able to help those who are most in need, and it really makes a difference, both physically and spiritually, to the people that we serve, at a time when they are at their most vulnerable point. As the chair, I would also like to welcome all of you for coming today. After years of planning, fundraising, and construction, this is beyond thrilling for the board, the hardworking staff, and the much-needed volunteers. This is truly a dream come true for us. It took a community to get here so that we can serve a community. As a former health plan CEO and EOHHS secretary, Governor Charlie Baker is one of those public officials who just gets it. He understands why medically tailored meals are so important for both physical health and fiscal health. It is my great honor and pleasure to introduce the Governor of Massachusetts, Charlie Baker. Thank you.
Just checking. Good morning. Let me just start, first of all, by congratulating everybody who's part of this team, not just for all the work you've done, but for the platform you've established here to go forward. And I do know that this is a classic example of to use I think an appropriate analogy, a lot of cooks in this kitchen. The state has a role in this. Philanthropy has a role in this. The city has a role in this. Private development has a role in this. And all of it is about supporting an organization that in many cases provides some of the most important nutrients that you possibly could to people who are dealing with very significant illness and disease. And the thing that I think is so special about this is it fits quite nicely with many of the things we talk about with respect to where we believe the healthcare system in particular needs to go. And that's to this whole notion that as a system, we've been focused primarily for a really long time on what I call transactional medicine and technology, and that has come at the expense of everything else. And a big part of why we structured our healthcare bill, which will be before the legislature in January, to nudge in a pretty aggressive way people into spending a lot more time and money on primary care and behavioral health services and gerontology and addiction services is because that whole piece, the time and therapy part of the system, has been missed. And in many respects, especially for those people who are dealing with very significant illnesses that impact their ability to even eat properly, an organization like this not only serves as a sustenance, but in many cases serves as a preventive mechanism to help them get better or stay better. And I think sometimes we forget that. And as I was in talking to some of the folks in the kitchen, and I said, well, explain to me sort of how the meal translates into the sort of problem you're trying to help people deal with and vice versa. And they showed me one of the meals, and it basically has, this is good for somebody under the following scenarios. And there's a whole bunch of stuff on the label. And I said, okay, so, well, how many of those do you have? They said, well, we got about 15 different criteria that we use when we put together these meals. And I said, well, how many different ways can you work the 15 criteria? So we have about 98 different meals, and every single one of them is built off of those 15 criteria and are tailored specifically to meet the needs and the requirements of the person or the persons who's receiving it on the other end. And first of all, that's an act of serious commitment to just figure this out in the first place. And secondly, it's a profound way to dramatically improve the quality of life for someone who's under those circumstances. And David and Secretary Sutters were talking about the fact that there are some things we could probably do so that they can do more of this. And we think that would be terrific. And I look forward to seeing this program continue to expand. I do want to say that in some respects, we have some odd bedfellows sometimes. There's about $800,000 worth of grants that was invested in equipment in that building that came from the Department of Agriculture in the Commonwealth. And it shouldn't be that odd, but the whole notion of the Department of Ag funding a program that's supporting medically complicated and sensitive folks on a program like this is just one more example of how sometimes you got to put a lot of pieces together to figure out if you have all the cooks in the kitchen that you need. But this is clearly a very special kitchen. We look forward to working with folks going forward, and this is a very special day for all of you. Congratulations.
Good morning. Good morning. My name is Peter Zane. I'm a very proud member of the Board of Community Servings, and also, along with my friend Merritt and my wife Ellen, we are co-chairs of the capital campaign at Community Servings. To anyone in the nonprofit community, our next guest needs no introduction. In her 5 years role as the executive officer of Health and Human Services, Mary Lou Sutter has led a transformation in how healthcare is delivered in Massachusetts, one that recognizes the importance of social determinants that impact a person's health. She leads 12 agencies and Mass Health with a combined budget of $24 billion and 22,000 public servants delivering essential services that touch the lives in 1 in 4 members of our state. Please welcome Mary Lou Sutters.
I'm somewhere between the two. Good morning, everyone. I'll be brief. It's a perfect New England day for a ribbon cutting. Truly, I just take a pause for a moment for all of you who have been involved with Community Servings for its 30 years history, whether you were a volunteer, whether you were in the original site in Roxbury, or whether you were here just a few months ago when there were still backhoes outside. It's an extraordinary day when you think about this development will triple food production, and I don't mean food production, because what I really mean is emblematic in the logo that is Community Servings, which is a casserole with a heart. Because all of us, if you've ever been sick, and you know how hard it is to eat, and yet how important it is that you need to eat, that not only does the food need to be nutritious to help you want to eat again, but it also needs to be inviting. It needs to be appetizing. It needs to be appealing. Because it is, we all understand the physical connection of food to our body, but there's also a psychic connection of food to healing. And for us to heal, it is important to have nutritious, appealing, good food. And that is one of the things, somewhere I have my remarks, but I'm sort of riffing, because food is extraordinarily important to all of us. And one of the things, I don't transform anything, I'm a restructuring kind of a girl, but one of the things that was very important to us as we were restructuring our Medicaid program, which is an important health insurance program for about 1.86 million people, almost 1 in 4 people in the Commonwealth of Massachusetts, was to that plus the Governor's Health healthcare bill was to really connect whole health, our physical health, our behavioral health, and yes, the other things that are our context of health, and that is food and housing insecurity. And so one of the things that we were, and I won't get too wonky, I promise, one of the things we were really proud about when we were restructuring our Medicaid program and working with the federal government is we were one of the very few states that was able to negotiate with the federal government to extend our Medicaid program to include food and housing insecurity as a pilot. So don't get overwhelmed, don't go run out and spend all the money. It's a small piece of our Medicaid program. It's about $150 million. And on Friday, we will make our formal awards with our 17 accountable care partners and their community partners. I'm going to let David take the get the swan song here. But what I was going to say is community servings will not be disappointed in the formal announcement on Friday, but I believe the news has already leaked. One of the things when you run Medicaid is it's often, or we're in state government, we're often the generators or the receivers of bad news. So I think my friends in Medicaid just can't, when there's like good news, they just have to start, they leak it all over the place. We're really, really pleased about that. But more importantly, I want to thank the board. I want to thank David for his vision and working with extraordinary staff. And there's one other thing that makes community serving special. It's also a special place to be. It's not just staff and volunteers, but community servings opens its heart to individuals who need a second chance at employment. Whether it's individuals who need to give back as part of having to work off time because they got into trouble with law, or for individuals who have had records in the past and are looking for new opportunities. So it's really a huge twofer. It's a great twofer for the Commonwealth of Massachusetts in terms of what it's doing and providing medically tailored meals to individuals who need them, and also providing opportunities for individuals who are trying to work and get back on their legs. So congratulations, David.
Good morning. I'm Merritt McIntyre, and I'm the chair of the Capital Campaign with Peter Zane, whom you met, and his much better half, Ellen Zane. But most importantly, on behalf of them, we just want to say an enormous thank you. It's really amazing to be standing here today at a ribbon cutting. So I will say that the City of Boston has been a great partner to community servings. Mayor Walsh's administration has been highly supportive of this project by helping community servings with the design, the permitting, and the financing of this complex project. It is my pleasure to introduce Boston's Mayor, Martin J. Walsh.
Thank you very much, Merritt. I too want to thank Merritt, Ellen, Peter for your great work, Karen from the board, David, all the staff here, all the volunteers here. It was actually fun walking through the kitchen and having the governor understand exactly. He seriously went into the details of every package. He held it in his hand. He was looking at it, very excited. So that's a good thing. So thank you, Governor, for that. I was really impressed. He knew a lot more about it than I did. So, you know, all of us are excited about this expansion. It's great. You know, 18 months ago, roughly, we were here for the groundbreaking, as was mentioned, and to see this transformation is inspiring. This organization, and seeing this organization, the ability to expand to more people throughout the Commonwealth of Massachusetts is also very inspiring as you think about what they do, serving the food, what you all do here. Community Servings does incredible work. When people need help, they're there, and I want to thank them for that. You're a helping hand and a beacon of hope during difficult times in people's lives, and that's something that we need to do more of these days. I want to thank the sponsors. As we walked around inside, we saw the different plaques. I'm not going to call you out, but thank you for sponsoring corridors, and thank you for sponsoring holding areas, and thank you for sponsoring walkways. Thank you for doing that, because great organizations like this can't do it on their own. Medically appropriated nutrition is vitally important to people's health, recovery, and long-term well-being. You heard Secretary Sutters talk about some of the transformations they're doing at the state, but it does also go back to nutrition and food. And that's when the governor was talking to David inside, and we're talking about it, the importance of eating healthy and the importance of eating right, and having so many families in the Commonwealth and the expansion of families in the Commonwealth, ultimately eating the foods they need to get better. It's not just about the medicine, and it's not just about the doctor's appointments. It's about making sure that you have a healthy eating lifestyle and creating opportunities, which is so exciting. This program serves a lot of people, but what's amazing to it, people give more than 50,000 volunteer hours per year. And when you think about that opportunity or that dedication, commitment, that's pretty incredible. You're helping people get involved to get back in the community and give back in a meaningful way. Thank you for providing those opportunities. Also, as we walked to the kitchen, we had a chance to see the job training program. And again, we heard a young man talk about the excitement of learning cooking and how important it is to cook. And he expressed the fact that cooking an egg, and what he said was a simple thing as cooking an egg, which isn't that simple, understanding the changes and what you can do to make that food taste different, and the impacts it has on young people. The 8 or 9 people that we just saw in the kitchen, I don't know if you're in the tent here, welcome if you are, but you could see the happiness and the joy in their face and the opportunity. And I asked Dave and a few other people, where do these folks go to work afterwards? And they all have opportunities to really create a vision for themselves and a future for themselves they otherwise wouldn't have had. So the component of job training is very important. At the teaching kitchen, they learn culinary skills as well as job training and life skills. And as we think about, if we think about helping the individual, the mission of the kitchen here today is to create opportunities and give healthy food to people. But it does so much more than that. It gives people second chances. It understands the importance that people can make mistakes and they can make a difference in what they decide to do next in their life. It's important that we continue these great opportunities. This is a big priority in the city of Boston. I just want to end by thanking everyone. I know that you're going to hear in a few minutes, I think there's about $250,000 shortfall. So anyone who's out there, there's about $250,000 shortfall. The secretary alluded to some state money, but that doesn't close the shortfall. The city money doesn't close the shortfall. This is purely philanthropic. And as you think about the opportunities, when you think about when you walk through the front door here, what this actually means. This is, in the heart of our city, is an employer, is a nutritionist, is a job trainer. It's a place for people to actually give back and volunteerism opportunities. There's so many things that happen here. So I just want to congratulate Community Servings on this big step. I want to thank everyone in this room, under this tent today, and other people who could be with us that support this effort, and everyone, and the board of directors and the leadership here. You should be very proud of what you'll be able to accomplish. This truly is amazing. So congratulations.
So we are surrounded by leadership today. It's wonderful, the leadership that Community Servings brings, the governor, the mayor, Mary Lou, and it's my opportunity and joy to introduce my leader, Ellen Zane. Ellen is a well-known healthcare executive, and without further ado, Ellen.
Good morning, Governor Baker, Secretary Sutters, and Mayor Walsh. Your presence here today means a lot relative to the mission to this organization. And Secretary Sutters, nobody could have said it better in terms of what the heart and soul of this organization is. As many of you know, my own background is in academic medicine, and those of us in academic medicine know that there are many, many organizations out there that do great work. But the issue was, could we prove that we do great work? And the fact is, this organization under David Waters' leadership proved it. many of you may understand that through Health Affairs, an important medical journal, and even more importantly, the Journal of the American Medical Association, JAMA, there has been excellent research that has shown that the efforts of community servings of medically tailored meals can reduce healthcare costs for this population in the order of 16%. For those of us that have worked in healthcare for a long time, we understand how big those dollars are, and there's no question about that. So to be able to say we do good work, many of us raise our hands and say we do good work. There are a few of us that can prove it. And in fact, it is being noticed across the Commonwealth and beyond. Many of the health plans have begun to work with community servings in order to provide this service for their members and patients, because it will in fact reduce costs. And beyond that, as Secretary Sutters indicated, through the accountable care organizations and through Mass Health in the Commonwealth, how lucky are we that we work in a state that recognizes that funds should be apportioned to programs like this that not only do really, really well, but save lives and help the families of those they serve as well. So we are incredibly grateful for the work in the Commonwealth and beyond, for the work of the wonderful people who are here. And we are so grateful to all of the donors. As Mayor Walsh said, we're this close. We're really this close. And it's important that we get this ball over the finish line. And thank you to our donors. On behalf of Merritt, Peter, and me, we have worked very hard and know that each of you, brick by brick, step by step, put this together. Thank you.
The Conwin Square Health Center has been a key referral partner for community servings. Today we have the manager of HIV services, Harbert Thompson.
Good morning, everyone. Thank you for inviting me today on behalf of Conwin Square Health Center, and thank you, Community Servings, for your steadfast commitment to our communities. Conwin Square Health Center was founded 40 years ago on the idea that while health and wellness must include the alleviation of illness, it also relies on a culture of health. That culture must address the social determinants of health, of which nutrition and easy access to food is a vital part. To address this, over at Codman Square, we have a food pantry and we have a teaching kitchen that serves thousands each year. However, with our partnership with Community Servings, we're now able to also provide medically tailored meals to a lot of our vulnerable populations in need. Currently, we have about 15 patients who are receiving our meals from Community Servings. We've heard a lot about the social determinants of health today, particularly access and food security, and how they greatly dictate the health of our communities. In Massachusetts, 1 in 10 individuals are facing hunger. And similarly, in Codman Square, food insecurity means that it remains an undue burden. Any adult facing hunger is at a heightened risk of developing a chronic disease such as depression, hypertension, or diabetes. For persons living with HIV and AIDS, additional to having a diagnosis of HIV, they often already have comorbidities. And based on the epidemiological makeup of the virus, HIV can affect the body's ability to absorb nutrients, to regulate metabolism, as well as reduce appetites and indirectly reduce weight. All of those factors increase the likelihood that a person living with HIV or AIDS could develop malnutrition, which ultimately impacts the goal of viral suppression. Over at Codman Square Health Center, we're very proud to partner with Community Servings, and particularly to provide well-nourished meals for our vulnerable HIV populations. Our medical case managers, they support our clients in the referral process by working with our nurse case manager and our HIV doctor to determine which meal would be particularly necessary for an individual based on their comorbidities. Our testimonials from our clients reflect that having access to fresh, locally sourced food can actually make the difference between making it or breaking it. Moreover, they report that they're wicked tasty. I've tried it. They're pretty good. Community Servings helps reduce those socially determined health disparities, allowing our clients to prioritize the needs, such as remaining vitally suppressed, caring for their dependents, and working part-time jobs so they can take care of themselves as well as their families. We're grateful for the partnership of Community Servings, and we look forward to the great things to come. Cheers.
It's now my pleasure to introduce Bubba Dayeme. He's a client of our medically tailored meals program, and he's why we're all here.
How far do I put it? Thank you. Thanks for having me today. It's a great pleasure to be here and having the chance to say thank you to Community Servings, especially the guys at in the kitchen in the back. My name is Buba. I live here in Boston with my wife, Desiree Allen, and my mom is also visiting from Mali. It's a long story, so I'll just keep it short. I found out I had heart disease in South Africa when I was 26. Then we got it under control, moved to Senegal, lived there for about 2 years. And I was on a fellowship by the State Department called the YALI program and Young African Leadership Initiative. So that was a trip to California, and that's where I found out that my condition was actually congenital, but then everything was spreading fast, and it turns out that I needed heart transplant. So I was born with a heart condition called left ventricular non-compaction. It's basically my heart muscle never formed. So over time it got bigger and bigger, and then it came to a point where I couldn't walk 2 flights of stairs anymore, and I was getting winded very fast. So we decided to move to Boston. That's where my wife is from, and I was transferred to the Brigham. And this was 2016. And 2017, I'm still on the heart transplant list, but in the meantime, I got implanted a heart pump that helps me, my heart pump better, and then that allowed me to slowly recover. This was beginning of 2017, and then all this to say how I came to community serving and how the timing was precious. So around the end of 2017, we found out we were pregnant again. So, and it turns out that we have twins that were on the way. So it was, thank you. So yeah, we were dealing with the heart disease. We had to relocate to Boston, and then she was pregnant with 2 big babies. So that's when I came across Community Servings, and then the food were really timely. So we didn't have time to cook every day, and the food were really adapted to my health. And this allowed me to get more and more active. I will sometimes reach out to the team, and they will give me advice on how to stay more energetic. And then this up to the point that they allowed me to go back to work. So now I work full-time. I'm back to doing what I love to do, which is working in energy conservation. And so to me, I always like to tell people, every time I tell them I've had disease, it's hard to believe. And then most people think of death first, but to me, it was mostly about being productive, being useful. So through this meal, I've not only been allowed to, have a good family life, spend time with my 3 little boys, be useful to community. So it's been allowed to also give me, hope for tomorrow, make me believe in life, and also make me believe in my own dreams that we hope to fulfill. So thank you for all of that. I want to say thank you to everybody. Thank you.
Thank you, Buba. Although not in the script, I will say that I just want to take one moment to say thank you to Tim Lee, who is our Chief Development Officer and got us over the finish line. Yeah. So David Waters actually got involved with Community Servings 30 years ago, first as a volunteer and then later as a board member. And then 20 years ago went in as CEO, and it was a small organization, literally reaching out to about 30 people. And through his leadership, we've gone from 30 people into the thousands. So just truly amazing. But I will tell you that certainly we're here today, not just because of his extraordinary vision, but also his unwavering commitment and his superior leadership. Thank you, David.
I must be somewhere in between on the heights here. Good morning. Good morning. It means so much that you're here with us. Thank you so much for joining us to celebrate this major milestone for community servings and our mission. Thank you to Governor Baker, Mayor Walsh, Secretary Sutters, and other dignitaries for your inspiring remarks. And thanks to Harvard from Codman and to Buba for sharing their stories. We are a community working hard to make sure that no one in Massachusetts struggling with a critical illness will be forgotten or left with an empty plate. To each of you here today, thank you. Your passion and engagement in our work is what has kept us moving boldly forward over the past 30 years. Here at Community Servings, we believe in the astonishing power of food. Food is sustenance. Everything man has ever achieved was made possible by food. Food is nourishment. It fills our stomachs, fuels our bodies, and wraps us in its warm embrace. Food, particularly today, is community. For few things in life compare to the simple pleasure of breaking bread with family or friends. Food is powerful medicine. It has the ability to heal not just the sick, but the loved ones that care for them. Food, indeed, is an agent of change. It has the power to engage world leaders, big business, and change the way America feeds the sick. 30 years ago, we began feeding 30 people in Roxbury and Dorchester dying of AIDS wasting syndrome. Today, we're feeding over 1,000 clients and their families struggling with 35 different illnesses, offering medically tailored, scratch-made meals. Beautiful food, prescribed to fit their exact medical needs, even when they face 3 or 4 different health challenges. But with that heartwarming service comes tremendous innovation, precision, and cutting-edge research, as Ellen outlined. Working with leading researcher Dr. Seth Berkowitz in partnership with the Massachusetts Department of Public Health and the Robert Wood Johnson Foundation, we've been able to prove a 16% healthcare cost savings when our medically tailored meals are provided to the Commonwealth's sickest, most expensive patients. That translates to a 49% reduction in hospitalizations and 72% fewer referrals to skilled nursing facilities. Indeed, we've proven that caring for sick neighbors in need is both the right thing and the smart thing. Today, I'm proud to announce that we are partnering with the Commonwealth, Mass Health, and 6 Medicaid accountable care organizations through the new Flexible Services Initiative to provide medically tailored nutrition to high-cost, high-need patients starting this spring. Indeed, this new building and its spectacular new kitchens will allow us to meet an unmet need for medically tailored meals by tripling the number of meals we prepare and deliver each year, and expanding our delivery area to all 300-plus communities across the Commonwealth as of January 1st. We will double the number of volunteers working in our kitchens to make the magic happen, from 75 volunteers per day to 150, and open one of the first universally accessible kitchens in the country to volunteers of all abilities and all ages, from young children to sight-impaired teenagers to developmentally delayed adults and seniors with mobility challenges, because we believe that everyone has a role to play in caring for the most vulnerable amongst us. We will also double the number of job trainees in our Teaching Kitchen food service training program, offering those with barriers to employment a path forward to good skills and a steady job, while they help us to prepare more meals for their own sick neighbors. Finally, we are launching a policy and research center to further prove the impact of our meals on health outcomes and teach our complex model of prescribed meals through a food as medicine accelerator to other nonprofit food programs around the country who are eager to partner with their own local health providers and insurers to ensure outcomes and lower costs. We are proud to be at the forefront of this new field, providing healthy, beautiful food to America's most sick, isolated, and hungry citizens in partnership with the healthcare community. With your generous investment in our work, we have raised, get this, $11,754,122 towards our ambitious capital gain campaign goal of $12 million. And we've leveraged federal, state, and city dollars to make this dream a reality here in Jamaica Plain. Only $250,000, as the mayor said, left to go, and every dollar counts. Whether you are an elected official, major donor, generous volunteer, a healthcare partner, a patient neighbor, or incredibly committed staff member, we could not have done this project without you. When you look around and ask how you can change the tenor of our times nationally or improve our communities right here at home, just remember the impact you have already had on our mission. It is a tremendous legacy for each of us, and we are delighted to celebrate it together this morning. Thank you. We think it is a bold and compelling vision with proven results, and we are so grateful to each of you for investing in our work, our new kitchens, and our shared passion for caring for those who have nowhere else to turn for a good meal. Thank you from the bottom of my heart.